To be honest, I decided late. I didn't know as a child that I wanted to be a doctor. I didn't have such dreams. But it came down to choosing a degree that would, on one hand, potentially lead me to an office job or policy making, so to speak. And the other one, obviously, was medicine. And I tried to imagine what I would enjoy doing. And the part of medicine that allows us to work with people every day to potentially help people was very appealing to me. Yeah. In medicine, I think generally patients come to us with problems and it's our job to help them solve these problems. In orthopedics in particular, these problems tend to be mechanical in the sense that it can be stuff like a torn ligament, a torn tendon, a fracture. And our job is to try and solve these mechanical problems, and that's very physics-based, which I always liked. So that includes things like mechanics and forces and vectors. So I would say the orthopedic principles of treatment always came naturally to me, and we get a chance to go through this journey of recovery with them, to see them return to, doing their daily activities, returning to work, or even returning to their sport and activities that they used to do. And likewise with shoulder, elbow, or even knee injuries, very often it's sports related, and seeing them return to the exercises that they enjoy is quite rewarding. I would say it's a privilege, and it's a big part of why I like my job so much. Yeah. Well, we don't have an official motto or mission, but I always tell my team that we want our patients to come first. And generally speaking, I think we try and treat our patients the same way that we would like to be treated as a patient. If anything, that would be our mission. That would mean that we always strive to be professional, ethical, and evidence-based in the way that we treat our patients. Yeah. Like most orthopedic doctors, I think we see a range of patients from young to middle-aged to old. For the younger and the middle-aged population, then these often tend to be things like sports or overuse kind of injuries that we see. So these can include things like shoulder instability, tennis elbow, golfer's elbow, wrist sprains, ankle sprains, and in the knees, things like ACL tears, meniscus injuries are really common. In the older age group, for example, those who are 60, 70 and above, then we see more degenerative kind of conditions, and these can include things like rotator cuff tears or arthritis in the joints of the hip or the knee joint, or even fractures or fragility fractures related to osteoporosis. In terms of services, obviously as an orthopedic surgeon, I do surgery for a lot of these conditions when it's required. But like I said earlier, a lot of these conditions can really be given a trial of non-operative treatment. So physiotherapy is a first-line treatment for a lot of these. And we have a network of physiotherapists that we work relatively closely with or consistently with, located in different locations in Singapore. So generally speaking, I try to match patients based on convenient location to their home or work, for example, or match patients with a physiotherapist who is experienced in the sport that they are pursuing, right? Because certain physiotherapists, for example, are very active with CrossFit, high rocks, powerlifting. So if a patient has that kind of interest, then that physio would be a good match for him. So that's my job, to try and match them with a good physio that fits them. Of course, besides physio, there are medications. It can be simple painkillers, topical, oral painkillers, anti-inflammatory agents, supplements even, or commonly injections. Yeah, so there are different types of injections that we do here in clinic. These can include steroid injections for joints. These are particularly effective for things like frozen shoulder. Then there are supplement injections, which are most well known to be used in the knee. And then more recently, we have things like PRP, which stands for platelet-rich plasma, which is showing to be increasingly useful for certain tendon kind of conditions. So it can be things like golfer's elbow, tennis elbow, Achilles tendon problems. So these are some of the services we provide in clinic. Of course, failing non-operative treatment or when otherwise required, then surgery for some of these conditions may be necessary. And if you talk about common shoulder surgeries, that will include things like shoulder stabilization procedures, rotator cuff repairs. In the knee, it would be things like ACL reconstruction, meniscus repairs, cartilage treatments in the form of microfracture or otherwise. For me, the first time I'm seeing a patient, I guess the priority is to diagnose or identify what problem they have. And this obviously involves proper history taking, a clinical examination, and then ordering appropriate investigations for them, whether it's things like x-rays or advanced imaging like MRI scans. That would be quite typical. Following which I will then review them after the scans or x-rays are done to go through the findings and see whether it correlates correctly with what I clinically suspect to be the problem. Now that's the clinical side of things. The truth is that the patient experience begins even before they see me for the first time. And this goes back to me stressing to my team that patients always come first. So before they see me, when they're trying to arrange an appointment, us being able or trying to give them as early an appointment as possible, or at least a time and date that's convenient for them, I think matters a lot to patients. There is obviously a rapport that one builds with patients over time. In the end, I think patients just want to be cared for. They need to feel that they can trust their doctor, that their doctor has their best interests at heart. And this comes down to making an accurate diagnosis, explaining it to them in their own terms in a way that they can understand, and then giving them options. So just having the knowledge and the options available to them and feeling like you are being honest with them, I think goes a long way. If they've had recent investigations done, or if they had recently consulted someone else for the same problem, then obviously things like a memo or x-ray reports or even MRI scan reports would be very helpful. But otherwise, no, I don't expect patients to prepare. I think it's normal for people to have aches and pains, right? Whether it's just from activities of daily living or aches and pains that arise from their sport or exercise. And practically speaking, they can't be seeing a doctor every time they have a pain for one day, right? But very often they do the opposite and they tend to neglect or ignore some of these pains. And then injuries can get worse, right? Because they are neglected. I would say in general, if they have a new pain that is persistent and not improving despite resting for 5 to 7 days, then it would be reasonable to seek professional opinion, to get examined, get diagnosed, and get investigated with x-rays or even a scan if needed. So I run clinics in 2 places, here at Gleneagles Medical Centre as well as Farrer Park Hospital. To book an appointment for either clinic, you can call us or email us or go onto our website and there's a link that will get you through. For Gleneagles, here we are right above the Napier Road MRT station and we are more closely located towards Orchard area. For Farrer Park Hospital, that is right next to the Farrer Park MRT station and it probably caters for patients who are more in the north or northeast side of things. Yeah.